Hello there, and welcome to NP Exam Coach, helping you pass your PMHNP board certification. On this training module, we'll focus on the four dopamine pathways. They are important because we need to assess those patients when they take antipsychotics, right? What happens on those four dopamine pathways? What do they do? And what are the side effects? Okay, so let's go ahead and cover the dopamine pathways. You will likely to have a question on this because it's an important subject. So let's learn together. This is our roadmap unveiling the dopamine pathways, module 5, training 5. Now, this is the dopamine pathway, right? So, when we say the dopamine pathway, we are talking about uh, patients that most likely use typical versus atypical antipsychotics. When I say typical versus atypical, I am referring to the typical being the first generation antipsychotics and the atypical being the second generation antipsychotics. So, what is the difference then? Well, it's quite simple, but yet super important to know this difference. Okay. So, the typical is the older generation, atypical, the new generation that is characterized by their 5-HT2A, which is the serotonin antagonism receptor. So the first generation lacks the 5-HT2A, while the second generation has it. And that is one of the main differences. So, what are the four dopamine pathways? Let's begin with the mesolimbic pathway. Here, when we look at psychotic patients, when we look at the schizophrenic patient, we think that the mesolimbic pathway is the one responsible for the psychosis because there is an excess of dopamine in this pathway. So it's a hyperactivity. For example, antagonism of D2 receptor in the mesolimbic pathway treats hallucination and delusion. Okay, so if we have a lot of dopamine in this pathway, we would have psychotic futures. So mesolimbic, don't forget the mesolimbic. When do we move on to the mesocortical? So if the mesolimbic you had too much dopamine, in the mesocortical you have a lack of the dopamine. If you have a lack of dopamine or decreasing dopamine, a mesocortical projection is postulated to be responsible for the negative side effects and depressive symptoms of schizophrenia. For example, lack of motivation, emotional withdrawals in schizophrenic patients. So, mesolimbic, too much dopamine cause schizophrenia like psychosis feature. Mesocortical, too low of dopamine give you a flat effect, meaning uh, negative the negative emotions and negative feelings like that we see with some patients that are depressed. Now let's move on to the third pathway. The third pathway is the nigrostriatal pathway, another very important. Every time you see nigrostriatal, the first thing you think is movement. Nigrostriatal is your movement pathway. You need to know that nigrostriatal has to do with your movement because this is one of the areas that we see most problems with antipsychotics, whether it's the first or second generation. However, we would see less problems with the second generation, but they still can happen. and they will happen, if they happen, is in the nigrostriatal pathway. In this nigrostriatal pathway, it modulates your motor movement. So, if we have a blockade here, it can lead to an increase of acetylcholine. Okay, so here the problem is when we have a blockade of dopamine, acetylcholine goes up. Dopamine and acetylcholine, they are in an inverse relationship. If the dopamine is up, acetylcholine is down. If the acetylcholine is up, then the dopamine is down. So in the nigrostriatal pathway, your motor movement here has to do with the blockade of the dopamine, and because of that, you have an increase in acetylcholine. So when this happens, it can lead to extrapyramidal symptoms, better known as your EPS, such as dystonia, parkinsonium, and akathisia. Okay, it can also lead to TD, right, which is also part of your EPS symptoms. For example, long-term DT blockade can cause tardive dyskinesia, DT, and involuntary facial movement. So we covered the mesolimbic so far too much, the mesocortical too little of dopamine. Now we said the nigrostriator is movement, and this has to do with the blockade of dopamine going down and acetylcholine is going up. So our fourth pathway is the tuberoinfundibular pathway. Okay, here we are talking about the blockade of D2 receptor in this pathway can lead to an increased prolactin. So if we just mentioned the nigrostriator, there was a dopamine and acetylcholine inverse relationship, right? So here in the tuberoinfundibular pathway, the dopamine and prolactin have also a inverse relationship. See, in this pathway, when you have a blockade of D2, your D2 is going down, you would have a increase of prolactin levels. So higher prolactin levels cause amenorrhea, galactorrhea, right? Sexual dysfunction, gynecomastia, and or osteoporosis. So this is important to know. It's important that you know when you have the problems here is because of an increase in prolactin levels, right? See, in nigrostriated too, the problem here is because of an increase of acetylcholine causing EPS. In the tuberoinfundibular, you have a blockade in dopamine and you have an increase of prolactin, cause the menstruation symptoms of amenorrhea. You would have galactorrhea, right? Uh, gynecomastia, and osteoporosis, in addition to your sexual dysfunctions. So, a patient with on antipsychotic medication experience decreased libido or irregular menstruation. Remember the mnemonics for calling the four dopamine pathways. Many men never travel, which stands for the mesolimbic, mesocortical, nigrostriatal, and the tubular infundibular pathway. They are so important, and I need you to get your points on the board certification. So let's do a check on learning. What is the difference between a typical versus a atypical antipsychotic? Well, if you remember what we just said, the atypical has the 5H2A specific, which is your serotonin antagonism. So the difference between typical versus untypical is that the 5HT2 2A is part of your atypical that lacks of the serotonin negativism blockade on the first generation. So it's a very important distinction. You should know this. Now, let's move on to another question. Check on learning. Which dopamine pathway is most affected in Parkinsonian disease? A. Mesocortical. B. Mesolimbic. C. Nigrostriatal pathway. Or D. Tuberoinfundibular pathway. I hope you get this question right. We just covered those pathways. If you didn't, please pause the video and memorize them. They are important. Well, I trust you that you got this answer right as the nigrostriatal pathway. So it is responsible for movement, and Parkinson's disease is characterized by a degeneration of the dopaminergic neurons in a nigrostriator, which connects to the substantia nigra with the striatum and plays a key role in modem control. Other pathways listed are not primarily affected by the Parkinsonian disease. Now, just a review again, because the four dopamine pathways are so important. So, again, the mesolimbic, the problem here is too much dopamine causing the psychotic features seen in schizophrenic patients, right? So, the most commonly associated pathway for the dopamine is triggered whenever the body experiences pleasure stimuli like food and sex. The mesocortical pathway, remember, is the decrease in dopamine, is used with results including decision making and memory and focus. But here we are specifically saying that the dopamine pathway, the mesocortical, has to do with a decrease in dopamine. The nigrostriator has to do with the decrease in dopamine and inverse relationship with acetylcholine producing Parkinsonian like symptoms. How about the tuberoinfundibular pathway? In this pathway, we are leading with the problem of prolactin release because of a decrease in dopamine. Again, an inverse relationship, dopamine and prolactin. And as we mentioned, it can cause many side effects, right? So, what are the side effects that we mentioned? We mentioned amenorrhea, galactorrhea, sexual dysfunction, gynecomastia, and osteoporosis. This is due to the increase in prolactin levels and the decrease in dopamine. Okay, so please know this. This is very important. And just like that, you memorize the four dopamine pathway. Do not get them confused. Understand the signs and symptoms of the increased dopamine or decrease in dopamine. Understand the relationship between acetylcholine and dopamine and the prolactin and dopamine, right? And the side effects. And that's it. If you can get that right, that's another point that you get on the test. I'll see you on the next training.